What causes high pulse pressure? Have you ever wondered why some people have a high pulse pressure? This is an important topic, especially when it comes to managing hypertension in elderly individuals. Let's break it down in a simple way. Pulse pressure is the difference between systolic and diastolic blood pressure. To calculate it, you subtract the diastolic pressure from the systolic pressure. For example, if the systolic pressure is 120 millimeters of mercury and the diastolic pressure is 80 millimeters of mercury, the pulse pressure would be 40 millimeters of mercury. One major factor that causes high pulse pressure is arterial stiffness. As people age, their arteries tend to become stiffer. This stiffness makes it harder for the heart to pump blood, leading to higher systolic pressures and lower diastolic pressures. Another cause is aortic regurgitation. This condition happens when the aortic valve does not close properly, allowing blood to flow back into the heart. This can increase systolic pressure and decrease diastolic pressure, resulting in a wider pulse pressure. Atherosclerosis, which is the buildup of fatty deposits in the arteries, can also contribute to high pulse pressure. This buildup causes arteries to stiffen, leading to increased pulse pressure. Conditions like severe iron deficiency anemia can decrease blood viscosity, which may also raise pulse pressure. Additionally, hyperthyroidism can increase heart rate and cardiac output, causing higher systolic pressures and wider pulse pressures. As we age, it is common for pulse pressure to increase due to vascular stiffening. This is particularly relevant in hypertension management for elderly individuals. High pulse pressure can indicate increased stiffness of the arteries, which is a concern since it can lead to higher systolic blood pressures. To manage hypertension effectively in older adults, it is essential to address factors that contribute to high pulse pressure. This can include lifestyle changes such as regular exercise and a balanced diet to maintain healthy blood vessels and reduce arterial stiffness. Certain medications can also help manage blood pressure and decrease the risk of complications associated with high pulse pressure. Regular monitoring of blood pressure and pulse pressure is vital to identify potential issues early, allowing for timely intervention. By understanding the causes of high pulse pressure, healthcare providers can develop targeted strategies to improve cardiovascular health in elderly individuals. This knowledge is key to managing hypertension effectively in this population.